Welcome to King Faisal Specialist Hospital and Research Center, Jeddah, the leading tertiary care hospital in the Western region. Since its conception in the year 2000, the hospital has been striving towards perfection in the medical and educational fields. The wise leadership of Dr. Tariq Linjawi has proven to be the critical factor in achieving said perfection. The hospital's immaculate function depends on a tightly knit web of highly productive departments working hand in hand to maintain the highest standards in the region. Today we'll be taking a virtual tour of the Clinical Services Department, one of the key players in the hospital. This department is comprised of many different divisions, each of which we will visit more extensively. Please follow me on a virtual tour of the Clinical Services Departments. We start off with the Anesthesia department. The workforce of this department is comprised of highly trained assistants called anesthesia technicians. The role of the anesthesia technician is to assist the anesthesiologists in the preparation and application of the equipment and supplies required for administration of anesthesia. The main activity of this department takes place in the operating rooms, where the technicians assist anesthesiologists in monitoring patients undergoing various types of surgeries. Anesthesia services are also extended to other parts of the hospital, including radiology, endoscopy, and dental clinics. On the second leg of our tour, we visit the Biomedical Engineering Department. This department has a team of 9 professional biomedical engineers with an experience ranging from 5 to 22 years. This qualified team of engineers renders its services to all other departments in keeping all biomedical equipment in optimal working condition, as well as assisting in the purchasing of new equipment. This department is also responsible for the annual or semi-annual maintenance of hospital equipment, in keeping with the international standards of the world-renowned institutes such as the CAP and the JCIA, for which our hospital is accredited. Most of the services and repairs take place in the biomedical engineering workshop within the hospital using the latest equipment and tools available. Over here, we find the Cardiovascular Catheterization Laboratory. This department provides an essential and vital cardiovascular service to patients presenting with acquired or congenital heart diseases. Diagnostic and interventional procedures are performed here, both of which amass sufficient and valid hemodynamic and radiological data. Optimal outcomes are achieved with minimal discomfort to the patient, always keeping in mind that patient safety and well-being come first. A wide range of cardiovascular disorders is dealt with in this area, including but not limited to valvular heart disease, cardiac tumors, and congenital heart diseases. Here we find the Central Sterile Supply Department. It is responsible for processing, sterilizing, and maintaining quality control of all sterile supplies in the hospital. Contaminated and soiled items are received in the decontamination area, where they are sorted, soaked, cleaned, and rinsed. From here, the one-way flow takes us to the preparation and sterilization area, where the items are inspected, packaged, and labeled for sterilization. The packaged items are then put through the sterilizer. After this step, the cleaned and sterilized items are packaged and transported back to the end users in clean, closed case carts to assure against inadvertent contamination. This department prides itself on being a reference to many outside institutes, as they have helped in establishing other sterilization centers in other hospitals. Follow me into the dental clinic. The Department of Dentistry performs its clinical practice in 9 clinics and surgical suites, equipped with state-of-the-art dental units and advanced digital radiography network. The department provides a full range of services through 6 functional sections, which are general dentistry, prosthodontics, endodontics, pedodontics, orthodontics, and maxillofacial surgery. Working closely with the dental clinic is the dental lab. This area uses modern, up-to-date technology to produce dental implants, attachments, aesthetic veneers, and reinforced composite. In February 2006, the dental laboratory launched the Procera dental scanning system, serving the Western region. Part of the dental lab was renovated and equipped as a dental laboratory training center. Here we come to the Department of Pathology and Laboratory Medicine. This department is an integrated anatomic and clinical pathology laboratory. It provides a broad, diverse level of testing matching the tertiary care mission of the hospital. Overseeing the day-to-day function of the lab is a team of highly qualified pathologists. A staff of nearly 100 laboratory professionals is committed to pursuing the highest possible quality of service using the latest technology and state-of-the-art equipment. Since 2002, the Department of Pathology and Laboratory Medicine has been accredited by the College of American Pathologists and the American Association of Blood Banks. The Department of Pathology and Laboratory Medicine covers a wide range of laboratory tests in all the major disciplines, serving inpatients and outpatients. This section also functions as a reference lab for outside institutes, hospitals, and clinics. State-of-the-art instruments are employed to perform the latest lab tests available. In future plans, the major laboratory areas will consolidate into one core lab entity for ease of function and faster, more accurate results. We have reached the clinical neurophysiology laboratory, where a variety of EEG procedures are performed on both in and out patients. EEG is a dynamic recording of electrical activity generated by the cerebral cortex and is an important diagnostic tool helping to localize lesions, to differentiate between diffuse and focal brain pathology, and aids in the diagnosis and management of seizure disorders. EEGs performed in the lab include routine 30 to 60 minute recordings, 2 to 6 hour video EEG recordings, and multiple sleep latency tests, recorded over an 8-hour period. Portable bedside EEG recordings may be performed in the intensive care units, as well as continuously over several days to monitor subclinical seizures and drug therapy. Other lab procedures are various EMG studies, including nerve conductions and needle EMGs, that aid in the diagnosis of disorders of muscles and peripheral nerves. Of particular interest and done only in certain centers, and under EMG guidance, are Botox injections for spasticity and movement disorders. New EMG equipment supporting this procedure will be delivered to this department in the near future. Part of the hospital's comprehensive epilepsy program is the Epilepsy Monitoring Unit, where video EEG telemetry is done. Selected patients who are potential epilepsy surgery candidates are recorded continuously for 1 to 14 days. Within a few months, additional equipment capable of recording from implanted subdural electrodes will be installed. Electrocorticography is another specialized EEG, which is done in the OR and recorded directly from the cerebral cortex during epilepsy surgery to further define the epileptogenic zone prior to cortical resection. This section, the Physical Therapy Department, is considered one of the best departments in the Western region. A highly qualified and reliable team, the physiotherapists in this department are experienced and committed to their patients. Well-established programs you can rarely find in other hospitals, like the rehabilitation of post-operative total knee replacement and ACL repair, are performed in this area. The physiotherapy department has a vast experience in sports rehabilitation using sophisticated machines like isokinetic biodex. A unique lymphedema rehab program can also be found here. In the near future, weight management programs in conjunction with the nutrition department are to be established. In the near future, the American Association of Cardiovascular and Pulmonary Rehab will accredit the department. The department will have the honor of being the first in the region to achieve such a standard. The next part of our tour brings us to the Radiology department. In the last decade, with the tremendous advancement in technologies and equipment, the field of radiology has benefited to a large degree. We are able today to image the most delicate and most minute parts of the body with the highest state-of-the-art technologies. With the introduction of the very latest multi-detector CT scanners, highly technical advanced ultrasound machines, and state-of-the-art magnetic resonance imaging technologies, diagnoses are made readily, allowing physicians to make the right treatment strategies to help their patients. In the field of interventional radiology, significant advancement was made to replace some surgical procedures, including biopsies, abscess drainage, and nephrostomies. The services provided by the section include general radiography, CT, MRI, ultrasound, nuclear medicine, mammography, and bone mineral densitometry. This department is one of the few in the kingdom that performs interventional examinations like angiography with coiling, stenting, and embolization. We have reached the Respiratory Care Unit. This department was established back in the year 2000 with only 4 staff members. Today, the section employs over 30 qualified staff members, providing services 24 hours a day, 7 days a week. The therapeutic activities provided by this department include medical gases and environmental control systems, including nitrous oxide, mechanical ventilator support, high-frequency oscillatory ventilation, artificial airway care, bronchopulmonary hygiene, pharmacological agents administration, and surfactant administration. Qualified personnel from this section attend all high-risk deliveries, including C-sections, cystic fibrosis clinic, pentamidine treatment, patient transports, bronchoscopy, cardiopulmonary rehabilitation, and hemodynamic cardiovascular support. Through this department, routine respiratory care is extended to patients in all wards and intensive care units. Our tour takes us to the Non-invasive Cardiology Laboratory. This department provides quality diagnostic services to patients including pediatrics and adults. Over 30,000 diagnostic procedures have been performed over the past 4 years, using the most advanced, state-of-the-art technology. These procedures include resting 12-lead ECGs, pacemaker checkups, exercise stress nuclear scans, adult and pediatric 2D echocardiograms, and dobutamine stress echocardiograms, to name a few. On the last stretch of our tour, we find the nutrition department. This section is consulted on a wide range of nutrition-related disorders, including but not limited to obesity, eating disorders, developmental disabilities, pulmonary disease, gastrointestinal disorders, cardiac disease, and diabetes. A differentiating factor for this department is the ketogenic diet. The ketogenic diet has been used since the 1920s for the treatment of epilepsy. According to Johns Hopkins International Survey on the Ketogenic Diet, this is the only hospital in the Middle East to provide such a service. In addition to this, the Nutrition Department is conducting the Jeddah Health and Nutrition Examination Survey. This survey will provide estimates of the health of male Jeddah residents by examining a sample of people who represent the Saudi male population. To accomplish this, medical staff and other professionals will travel across Jeddah in specially equipped mobile examination centers. The mission of this survey is to provide statistical information that will guide actions and policies to improve the health of the Saudi people. This will help informing the nation's principal health statistics agency, led by King Faisal Specialist Hospital and Research Center, that will work closely in the future with the Ministry of Health to provide accurate, relevant, and timely data. Drawing near the end of our tour, we have seen how clinical services, under the direction of Mr. Donald Capel and Dr. Sadah Ishki, provides a vast and essential range of services to the hospital and its patients. Hopefully, we have shed some light on the vastly important Clinical Services Department, and we hope you have enjoyed this virtual tour of the many clinical services departments. Thank you and goodbye.